Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by Untitled Hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're still on the topic of diabetes, and we're talking about how to treat diabetes. And we said metformin really was our drug. But don't be confused by the fact that metformin is our drug. We use other drugs in combination with metformin. So those sulfonylureas that I talked about earlier, didn't really give them much attention, but they're still good drugs. They're often used in combination with metformin. So if you remember these drugs, talking about drugs like glyburide, glipizide, glimepiride, diabeta, glucotrol, amaryl, respectively. Those were the drugs that we used in the beginning, but they're still used now in combination with metformin because metformin increases insulin sensitivity. So now that the other sulfonylureas that we add on increase the level of insulin output, we're getting more sort of bang for our buck. But what about people who can't use metformin? What about people who are resistant to its effects? Well, luckily for us, we ended up getting a little help from our friend the Gila monster, which helped us understand that there are hormones called incretins that diabetics and non-diabetics make. Now, non-diabetics make plenty of incretin hormone, and all that hormone really does is help us keep our blood sugars after we eat as stable as possible, right? By influencing the release of insulin and glucagon. But diabetics seem to either not make enough or make an enzyme that's too active to break it down too quickly. So how are we going to fix that? Well, you guessed it. Number one, give them something that mimics the incretin hormone. And number two, give them an enzyme inhibitor to keep their incretins longer. Okay, so the words I'm going to say next would be things like Trulicity, right? Where we've got an incretin mimetic, okay? Or Ozempic, another incretin mimetic, a drug that mimics the effect of incretins so that it looks like you're still making your own incretin. And that helps stabilize your blood sugar after you eat. And that makes it easy for us to manage diabetes. Okay, there's issues, of course. There's always an issue or risk of pancreatitis. With one drug, Victoza, there's an increased risk of thyroid tumors. But overall, these drugs are pretty safe just based on the fact that you see almost everyone's on them. In addition to that, if you can't use an incretin mimetic, because they are injectable, and not many people like to inject themselves every day or every week, then what about the Dpp-4 inhibitors? Those are the drugs that inhibit that enzyme that is overactive, that destroys the incretin hormone too quickly. And those are oral medications like Januvia, Onglyza, and Tradjenta. And those do a good job in keeping the existing incretin hormone that the diabetic makes active for longer. Okay, still issues with pancreatitis, still issues with the potential for hypoglycemia. And don't forget, there's always the issue with not just hypoglycemia, but also ketosis. And that comes up with some other medications like Sglt2 inhibitors. You recognize these names as Invokana, Farxiga, Jardiance. These are drugs that help the kidney excrete more glucose, and that lowers your blood glucose, right? What's fascinating about these drugs is that technically, since they don't involve insulin, they could be used for both type 2 diabetes and type 1. But remember, because you're fooling around with blood glucose, there's always the issue for both hypoglycemia and ketosis. And of course, let's not forget our favorite drug of all time, insulin. Everybody knows that insulin is our drug. It's probably the most effective in lowering blood sugar. But insulin's greatest limitations are the fact that patients sometimes don't like to use the amount of insulin they should because insulin makes you gain weight. However, most people use it the way they should, and ultimately that means they lower their blood sugars and keep their blood sugars stable. But we haven't really reached a point of convenience with insulin. Just we have Lantus and Tresiba and Levemir that are once daily insulins, but you still have to inject yourself once a day and manage your blood glucose with sticks and glucose testing. The good news is we've come a long way as far as inline, if you will, blood glucose monitoring with Dex monitors and so on. So more technology means a greater facilitation and greater ease for our diabetic patients. So More on that, my friends, coming in the future. But in the meantime, just wanted to make sure you are up to date on the latest in managing diabetes. Again, this is Tom Viola. So happy to be with you for yet another Fast Facts Pharmacology Edition. See you soon. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Facts.